fungal diseases. So we're going to talk about those now. So when we talk about fungal diseases, these are aerobic by nature. So these are teeny tiny little microbes that make their way into the lower airways. And if they're aerobic by nature, what kind of environment do you think the lungs are? Aerobic, right? Full of oxygen. So when the fungus reaches the lungs, it germinates and it will produce leukocytes and macrophages that move to fight these fungal spores. But when that happens, you get this pulmonary capillary dilation, and then the interstitium fills with fluid, and then that causes swelling of the alveolar epithelium, and they end up with pulmonary edema. So you can kind of see how there's a cyclical effect of like, well, there's more damage going on. So the pulmonary capillaries are going to dilate more. The interstitium is going to fill with more fluid. The swelling is going to happen at the alveolar epithelium, and it's going to produce even more pulmonary edema. So you can have severe causes of tissue necrosis and granulomas and cavity formation. And the healing process for this is quite extensive, but throughout the healing process, it can kind of cause some calcification and some fibrotic lung tissues. So what does that sound like if you have this fibrosis and this calcification? Yeah, you're going to end up with some pulmonary interstitial disease or some pulmonary fibrosis. What's your patient going to sound like? Yeah, this patient could have a lot of crackles that are going on. A lot of times, the most common areas of involvement are the posterior segments of the upper lobes when we talk about these fungal diseases. So, definitely want to make sure that we are attuned to the breath sounds that we're listening to and the symptoms that the patient is presenting with. So fungal spores will spread throughout the air, soil, animals. It's in normal flora. We have some structural changes that occur as a result of these fungal infections. So you can see alveolar consolidation. You have alveolar capillary destruction or the dilation that lead to granulomas and cavity formation and fibrosis and secondary calcification that can lead to pulmonary fibrosis. We talked about it earlier. So when we break this down, there's actually 4 different types of fungal infection. 4 different types of fungal infection. There's the histoplasmosis, the coccidioidomycosis, blastiomycosis, and yeast pathogens. So these are the 4 major types of fungal infection. With the histoplasmosis, we talk about this. Another name for that is the Ohio Valley fever. We usually see this in bird excrement. Usually you see this in chicken houses or pigeon coops, barns, trees with blackbirds and bats. So lots and lots of bird excrement is where we would see that. It will resemble TB. It'll resemble TB, and it has actually a 17-day incubation period. Only 40% exhibit symptoms, and only 10% of those are bad enough to go to the doctor. So typically you have this most common fungal infection, Ohio Valley fever, and your symptoms aren't even bad enough for you to even get checked on. They have what's called asymptomatic histoplasmosis is the most common, and there are no signs or symptoms, only residual lesions in the lung parenchyma or calcified lymph nodes after the fact. So kind of one of those crazy things that you don't feel bad at all. but when you go for a routine checkup or you go for a chest x-ray years later, you'll see the aftermath, if you will, of the histoplasmosis. You can have an acute symptomatic pulmonary histoplasmosis where you have mild to serious illness. These patients typically have like a fever or muscle or joint pain, headache, dry, hacky cough, chills, chest pain, weight loss. They'll have some sweats. This is actually a life-threatening condition that is what's also known as spelunker lung, that people that go spelunking in bat caves can get. So again, all of that bat excrement can lead to a life-threatening condition called spelunker lung. Then there's chronic pulmonary histoplasmosis. You have patients with pre-existing lung conditions like emphysema. Typically, middle-aged males will have signs and symptoms of tuberculosis and can have a progressive destruction of the lung tissue. So this is not a very good one that you want to have. Then there's what's called disseminated histoplasmosis. So these are typically in the very, very young or the very old that are unable to kill fungal organisms, can impact any organ. So if this disseminated histoplasmosis goes untreated, it is actually fatal. Other patients that are at risks for this disseminated histoplasmosis would be patients that are immunocompromised, HIV, patients that are on chemo or radiation. Those are the ones that you want to be mindful of when it comes to the histoplasmosis. The coccidioidomycosis is the San Joaquin Valley fever, and this is from direct contact and direct visualization. Blastomycosis is the Chicago disease, again, direct visualization. And the last one that we have is yeast pathogens. We see this typically with thrush. So for us, when we are delivering DPIs, especially those that have steroids, you have an increased risk of infection by giving patients with a DPI that have a steroid, and that infection is thrush, which is a yeast pathogen that can lead to a fungal pneumonia. So make sure your patients are rinsing their mouth out when they do a DPI. They can spit that out into the emesis basin. They can spit it out into the sink, or they can swallow it. I would much rather spit it out than swallow it. But if they don't have the means to spit that out, then they can swallow it, and there's not much harm from that. So patients that are immunocompromised, I brought this up a couple of times. They have more of a risk. They have more of a risk to get pneumonia, and there are a number of different pneumonias that you can see here. But we have a number of different of infections or sources of infections, especially for the patients that are immunocompromised. Go ahead and circle severe acute respiratory distress syndrome and flu A. Highlight those two. Those are rickets and varicella, rubella. These are all of these others. These you want to make sure that you know are associated with your patients that are immunocompromised. So go ahead and highlight those. Ooh,